grew with respect to the elements that we had available to us. No, and certainly we didn't see anything carrying over that was primary toxicity. So when we're looking at the process, I think it's the process that needs to be upgraded.
Hi, my name is Barbara Taylor. I'm with the Office of Environmental Health Services.
Mr. Taylor, I'm sorry. The question I have revolves around what's been discussed here today in terms of the site selection. And the gentleman who suggested that while selecting the site, say a printer, would maybe not have given you a large enough sampling to make any broad conclusions, they still felt that it would have been valuable. Can you speak at all to why DHHR would not have wanted to intervene with those selections that were made by DEP and say, hey, by the way, we have been having reports here, how about this?
I was not directly involved in those meetings. We did have staff in each of the planning meetings that DEP held. We did not, as DHHR, take the position of driving the selection for sites. We did, as much as Dr. Duckman explained, look at phase 1 and phase 2 and the division of responsibility there. We looked at phase 1 as a DEP responsibility. They have the experience in the sampling. They also know those sites in a way that we don't. And I believe, and I could be incorrect, but I believe that a lot of the printer issues began being raised, at least to us, at the time the sites had already been selected. And I may not be correct on that, and I will stand incorrect if someone from DEP or one of my staff tell me differently, but that's my recollection. We did talk about adding printer, but at the time, those sites had already been selected, sampling had already begun.
So it would have been, in your view, or at least in DEP's view, at that point, too difficult to go back and add another site?
Again, I was not part of those meetings on a day-to-day basis, so I really can't speak to whether it would be difficult, but I believe the sampling was already in progress and the sites had already been defined.
Okay, and within that, I wanted to piggyback on what Delegate Mann suggested earlier. I think it was the anticipation of the legislature, based on the number of reports we had from 2 areas, and printer was just one of them, that some consideration by someone would be given to doing some sampling there. But apparently that discussion really never occurred. I mean, you did say that you looked at printer, but what was the reason again that you determined that it wasn't a good idea?
DHHR did not determine one way or another whether it was a good idea. We were really not we did not feel we were the driving force behind site selection. We were there to enable us to have consistency from phase 1 to phase 2, because we had already had discussions with WVU about the possibility of doing some contract work, because they have the capability to do that from both a medical standpoint as well as the hydrogeological standpoint that we don't. So we felt that was in our best interest and the public's best interest to get greater information that WVU could provide. So our goal was to at least have that consistency between the phase 1 part of the project, so as we move this to phase 2, we understand what happened during the site selections, during the sampling, during the putting together of the phase 1 report. But we did not drive those site selections. There has been additional discussion about printer, and I'm not so sure that there isn't additional work that may be considered by either DEP or DHHR. We did some initial analysis of cancer rates within our cancer registry program and provided that to Senator Stallings a while back. We'd be happy to share that information that we provided to him.
Certainly, I can understand the business of you not wanting to drive the selection of those sites, but I would assure you that it is my belief that DHHR, this is an issue reflective of public health.
Right.
You should have been driving that issue. I assure you that is my impression, and perhaps the impression of other folks here too. I'm not telling you that you did something wrong. I'm just essaying the idea that where a health issue of this magnitude is concerned, then you should be on an equal playing field with DEP. You should be able to go into the room with them and say, okay, that's the selection, but wait a minute, what about this? So I think that from my point of view, I would have preferred that DHHR be more aggressive in developing those site selection criteria, albeit that is after the fact now. As you say, there may be something that's going to happen somewhere else with regard to printer. I would hope that that may become a shall, because that's where we saw the rubber hit the road. And if we're not willing, for whatever reason, to take that up, then I don't know what our purpose might be in terms of trying to invoke good public health or invoke good public health policy. I say that not in the form of a question. I apologize, Mr. Chairman, but I felt that it was important to the discussion, and thank you, ma'am.
And I'm just wondering if, in following up this issue, before we jump to any conclusions and before we decide what we're going to do as a legislative body, is that we invite some of the folks over from Virginia to speak with us, and let's find out why they did what they did, for what reason. And maybe that will give us some answers that we're not getting in this report.
My name is Maria Lambert, and I'm a printer resident. I have been there for 51 years.
Pull that mic down for me.
Thank you.
You wanted to address the committee?
She wanted to ask me some questions.
All right, down the flash out.
I will try to answer them.
The gentleman who spoke first was
talking about the people who were still there and about leases being terminated.
Mm-hmm.
It sounds like has your family been there a long time, or
A long time.
how long? If you know?
Oh, a couple hundred years.
Okay, that's a long time.
It's a long time.
Do you know if, so you're not one of the people that have a lease?
No. My mother did my mother and father did when we lived in the main community, which is on, by the way, a well system. The people between the main community and where I live are all on well water.
Okay. Are you on well water?
I am not on well water any longer, thanks to West Virginia American Water.
Okay. Do you know anything about leases being terminated?
Mm-hmm.
Other than what he said?
Right.
That was wanting some more information on that.
Okay, back in the late 50s, they offered people who lived there a 50-year life, they called it a 50-year lifetime lease. And at the end of this 50 years, Federal Land Company or Federal Coal Company had the option to make or break a new lease or what have you. And so I would assume that this is what's happened. At the end of this 50-year lease, they've decided that they have other things to do, or maybe whatever their reason is, they're no longer going to renew those leases. But from what I understand, and you know, you can hear anything, I don't live up there anymore in that main community, so from what I understand, they are now charging people $1,000 up front to move a mobile home in there, and they're making people that own their houses but not the property. It's kind of like living in a mobile home without the wheels. If you don't want to pay the $150 a month rent, then you tear your house down and leave. That's, you know, but
I'm not sure I understand. So they have options. One is to live in a
but they have to upgrade those homes to a certain standard. They have to have vinyl siding on their home. They have to have new roofs on their homes. They have to have, and some of these things are not, I would say it would make good sense to upgrade, but for people who have lived there and don't have the means to do these upgrades, then it's a little bit more complex for them, I